I've ridden the bike more in the last week or so of rehab than I have in my life, I think, as far as getting my legs in shape. And so if nothing more, at least I'll have great condition with my legs. Well, actually it started off with a chest cough. I just couldn't get rid of the cough, and they'd give me some other medication. I tried it and didn't work, and so the doctor finally decided to give me get a chest x-ray, and in the process he did an EKG.
You know, he never stops, but he seemed to be just a little bit more tired. We had gone to New York, and he wasn't his vim and vigorous self, and it was when we came back that he went into the doctor for the second time.
We have known for the past 3 years that he has a abnormality of the aortic valve called a bicuspid valve, a congenital abnormality, one that he was actually born with. And over time, even though those valves are typically very functional for many, many years, they do begin to degenerate and calcify. They become somewhat stiff. And that's exactly over the years what Mr. Edwards has experienced until about 3 months ago, when he began to have notable shortness of breath and a decrease in his ability to perform exercise. And at that point, on serial evaluations with ultrasound, it was noted that that valve had become critically stenotic and was in need of being replaced.
What I appreciated was during surgery, it was about a 5.5-hour surgery, is that we were informed, the family were informed. Every new procedure that was happening, somebody came and told us in the waiting room if the heart, you know, what was going on in different aspects of the surgery. That's important to the family that's waiting. And it was over Christmas, and people said, oh, spending Christmas in the hospital. Christmas in the hospital for us was great this year. We were treated with a lot of service and understanding and compassion. So we've had a good experience.
Well, Mr. Edwards has a great family, a very supportive family, and the family is critical in the patient's recovery. We try to engage the family, keep the family well informed. That keeps the family's anxiety down, as well as keeping the anxiety down of the patient.
So I always say that Dr. Mitchell is not a doctor of the physical heart, he's the doctor of an emotional heart too.
I don't know how it could have been any better. I've thought about this a lot, and ironically we're going to Houston Wednesday to receive an award from the American Heart Association. It had nothing to do with this surgery. This was something that was established 2 or 3 months ago, and I've been thinking a little bit about what to say, and what I'm going to say is that I just could not have been in better care, better treatment. There's no way I could get it any better anywhere, in my opinion.